would like to welcome you to the Canada Fetal Alcohol Spectrum Disorder Research Network's webinar, Substance Use and Treatment of FASD Populations. Thank you all for joining us today. You may have a few people joining us in a minute or two as well. While we wait, feel free to put in the chat where you're located and the respective treaty territory. My name is Capri Rasmussen. I'm a social worker in practice in Calgary, and I work for Aamena Center of Excellence for Women with Addictions. Aamena has been providing addiction treatment for women since 1970 from a trauma-informed, concurrent, capable philosophy. We also provide specialty programs for pregnant women and women with FASD. I'd like to take a moment to do a land acknowledgement now. An important step in reconciliation is the acknowledgement of traditional treaty lands and recognition of the people of the territory. The Canada FASD Research Network recognizes the historical significance and contributions of Indigenous peoples and their cultures and understands the important role that the Indigenous community plays today and in the future. We acknowledge that we live, work, and meet on traditional territories across Canada of many of the First Nations, Métis and Inuit, whose footsteps have marked these lands for centuries. Just a few housekeeping items before we get going. We will be recording this presentation and it will be available on the CanFASD YouTube channel. The Zoom has a Q&A function where participants can ask questions and upvote these questions so that most common will rise to the top. There will be a time after the presentation to have the speakers answer any questions that are put forth. So you'll see at the bottom of your screen a Q&A, which is separate from the chat function. I'll take a moment now to introduce our wonderful speakers. Our speakers today will be Dr. Aamena Kapasi and Elizabeth Carlson. Dr. Aamena Kapasi is a researcher with the Canada FASD Research Network and is leading the Substance Use and Addictions in FASD Populations study. Aamena completed her MA in Counseling Psychology at the University of Western Ontario and her PhD in School and Clinical Child Psychology at the University of Alberta. Aamena has been researching FASD since 2013, focused on supports and interventions for individuals with FASD. She has a passion for both research and clinical work with children, youth, and families. Elizabeth Carlson is a researcher and project manager with the Canada FASD Research Network, and she's leading the youth phase of the Substance Use and Addictions in FASD Population study. Elizabeth completed her master's in clinical psychology at the University of Guelph. She is currently a graduate student in the University of Alberta in the School of Clinical Child Psychology doctoral program. In her personal research, Elizabeth has focused on forensic assessment, strength-based assessment, and assessment practices with Indigenous youth and their families and caregivers. As a research team member, she has helped to explore FASD prevention programming in Indigenous communities in Alberta and create the housing framework for individuals with FASD. She thoroughly enjoys working with and learning from children, youth, and families. Thank you so much for joining us today. And with that, I will let the presenters take it away.
Thank you so much, Capri. Awesome. I'm just going to share my screen and we'll get started. All right. So welcome. I'm Aamena Kapasi, and I'm here today with Elizabeth Carlson to speak with you all about substance use treatment recommendations for working with individuals with FASD. So I did a postdoctoral fellowship with the University of Alberta, and in that position, I worked on a project exploring best practices for substance use treatment for individuals with FASD. This is such an important topic for supporting individuals and for supporting prevention of FASD. So today I'm going to provide information on the project and discuss the resources that were developed as part of this project. First, I'd just like to thank our amazing team and supporters who made this work possible. We had a great research team nationwide, as well as our support from the Canada FASD Research Network and Health Canada. So our research team has developed a guide which outlines current practices to support individuals with FASD who are in treatment for substance use. Our hope is to build on the practices that already exist within programs and create further conversation and consideration for the unique needs of those with FASD. So this guide is available on the CanFASD website. So just a little bit of background on this project. So our guide was developed between 2020 and 2022. And so this project consisted largely of 3 phases. First, we conducted a scoping review, which resulted in 54 relevant articles. So as part of this review, we looked at existing literature about substance use treatment for individuals with neurodevelopmental disabilities. And this helped us understand what the literature has recommended. We also sent out a survey to treatment programs across Canada. And we got responses from 51 treatment providers, and we interviewed 7 treatment providers. And we learned from these treatment programs what they already knew about working with individuals with FASD, what they were already doing, and also what needs they had and questions they had to better serve this population. We also, as part of this project, interviewed 7 caregivers and 8 individuals with FASD to learn from their lived experiences. And then we combined all of these components, so the practice insights from service providers, the contributions from the research, and the lived experiences to combine them with consultation with an advisory committee. And this advisory committee consisted of people with lived experiences, caregivers, service providers, researchers, and policymakers. So we put all of that information together and contributed to a shared understanding we hope to communicate with you today. We'll be sharing a few of the quotes from individuals with lived experiences throughout this presentation to be kind of represent the core themes. So just a little bit of background. Across Canada, substance use and addictions represent serious health concerns, and many individuals with FASD struggle with alcohol and drug misuse. Many people with FASD and those with substance use in general have struggled to find treatment and care that's responsive to their needs. And so some of the barriers identified during our data collection guided us to areas of need that informed our recommendations. So this included understanding of brain-based differences and considering ways which an FASD-informed approach may be applied alongside work in treatment settings to promote healthy outcomes. So just an example here, quote from one of our participants. He, of course, has not been able to complete a treatment program and says he'll never go back to them. And I can understand that because treatment programs really aren't set up for our folks. So this kind of exemplifies the need of having some FASD-informed treatment programs to really set up the programs for those individuals and their needs. So I'm just going to present in this presentation kind of a roadmap of sorts that was developed from the research from this project. I hope that the insights I highlight today can support treatment providers who work with individuals with FASD. So this diagram is going to be kind of our roadmap. So the research team organized the recommendations within this 4-layer circular diagram. The circle represents a holistic wraparound approach to accommodations rather than a step-by-step prescription. And the layers are intended to be approached from the center. So beginning with understanding the person with FASD, as you can see here, and then moving outwards to applying an FASD lens to the treatment cycle, and then enhancing program practices to be FASD informed. And then in the most outer layer, we talk about FASD informed and enacting person-first philosophies. So with treatment centers often having limited time and resources, the intention was for the elements of this guide to be used as an adaptable recipe, perhaps affirming and valuing accommodations already in place, or perhaps noticing areas that would be impactful and doable addition. So the aim is not to develop a brand new treatment program or completely create an FASD treatment program. It's to adapt existing programs to include some of these elements or consider some of these things. They may be things people are already doing, or they may be new additions. So let's begin with the center of the guide, that inner circle, understanding the person. Moving towards FASD-informed care begins with learning from and valuing the experiences of individuals with FASD. An experience that individuals with FASD shared with us is expressed in this comment. I think the biggest thing that you can't assume is that if you know somebody with FASD, that's how every individual is that has FASD. You're all impacted different, so whatever's going to work for one isn't going to work for the next. So the two main elements of substance use treatment centers might use to understand the person are recognizing individual brain-based differences and applying practices for identification of FASD. So individuals may be impacted by brain-based differences to varying degrees, and that will impact their ability to engage in treatment differently. Individuals will have different strengths that can create different routes to meeting their goals. So in the guide, we provide tables with information about what a service provider might see, why, and what they might do. So here's just an example of a table for language. So again, some individuals with FASD, this might be a strength for them. Other people, this might be an area of deficit. And so being able to understand what you might see in their behaviors or in their actions, why, and what you could do about it. So there's similar tables for different areas that are very common, common areas for individuals with FASD. And then we talk about identification and screening. So in terms of identification, these brain-based differences may not be easily evident upon intake to treatment. So individuals may come to treatment without ever having been diagnosed with FASD or with complex mental health that makes FASD difficult to recognize. So our guide also gives practical tips and tricks for screening practices. For screening practices that can help identify individuals with FASD early on in treatment so that they can be supported effectively. All right, so that's the inner layer. And now we're on the second layer, applying the FASD lens to the treatment cycle. So there's typical processes when someone enters substance use treatment. And so our aim was to make the recommendations at each step of this process and discussing how brain-based differences can be accommodated for at the various stages of substance use treatment. So this is kind of a typical process. So we have people that enter treatment and then they're in treatment, adjusting to those treatment practices, and then transitioning out of treatment, and then maintaining or re-engaging in the future. So barriers often come up for individuals with FASD during entry to treatment programs, throughout treatment practices, when they transition out of treatment, and when trying to maintain or re-engage. So it's vital we look at where we can support those with FASD at all stages of their treatment journey. So in entry to treatment programs, we can look at our eligibility requirements, right? We heard from some folks that it was hard to even get treatment programs to accept them because of FASD or because of their history. So looking at, who are we allowing into our treatment programs? Can we make that more accessible? And then support for administrative barriers. When people are entering treatment, obviously, often there's a lot of paperwork to fill out or certain requirements. And so trying to make that a little bit easier. When you're in treatment, things that we know can be really helpful are, having some structure and consistency. Individuals with FASD often find that really helpful. But also at the same time, allowing for flexibility, right? Being able to adapt your program to the needs of that individual. And then also accommodating for sensory needs, which are often common in individuals with FASD. Then once you're finished treatment, you're transitioning right after treatment. And so in that area, some things to consider might be creating that transition plan collaboratively, bringing in caregivers, bringing in the individual with FASD, all working together to see what supports can be in place once they're transitioned out of your treatment program. And addressing life circumstances, right? Sometimes this might be even as basic as helping someone get identification or maybe some housing, employment support, education support, those kind of things that they're going to need when they're out of treatment. And then at the kind of end stage here is maintaining and re-engaging. We do know that often with treatment programs, not just for individuals with FASD, just for everyone, often people go through treatment more than one time. So having that follow-up support to be able to monitor people once they're out of treatment and co-developing that treatment plan if they are re-engaging back in treatment, kind of what worked last time, what can we do differently this time, that kind of thing. So our research suggests a variety of individualized and relational approaches to overcoming barriers in each of these stages. So some of these, as I kind of mentioned, were including natural or professional supports involved in the intake process, having predictable structure with flexibility, prioritizing transition plans that are realistic and desirable to the client, and ensuring follow-up support is available. All right, and now we're at our third layer. So the third layer of our guide holds 5 recommendations for enhancing substance use treatment practices to be FASD informed. So interview participants shared with us that, something that's quickly judged that when it comes to FASD is that they think you're lazy or you don't want it, that you're not willing to do the work, that you don't want recovery, that you're here, wasted time, wasted money, or you're here for the wrong reason. And most of the time, I don't think FASD or no FASD, nobody chooses to want to be an addict. So individuals with FASD, as this quote kind of exemplifies, can often be misunderstood as not trying or not being serious about treatment, when in reality, the individual often really wants to do well, but they're needing support to navigate those brain-based barriers that occur maybe in language or memory and attention or learning and participation. So treatment providers are working hard and may not be supported or equipped to be providing the accommodations that would empower success. And so this layer of our guide suggests approaches to treatment design that can meet those needs for support. So the first one is FASD training and education. So within both frontline and administrative levels, this can enable staff and systems to recognize why certain struggles are happening, what the accommodations can be, and recognize that these accommodations can improve success. So having actual specific FASD training is an ongoing process as staff turnover occurs or new barriers or opportunities for improvement present. So in our research, we found that very few of the treatment centers actually had FASD training as part of the training for their staff. And we want to emphasize the importance of education about FASD. And we hope the work we've done as part of this project will provide some training opportunities. So, being able to distribute our guide, we are working on an online training as well. So we're hoping to boost this area. We also, in our research, found a lot of people talked about considerations towards FASD prevention and treatment. This is essential, especially for treatment centers that work with pregnant mothers. Stigma is a major barrier in prevention, and our guide offers strategies and supports to talk about prevention of FASD as well. We also found that a harm reduction philosophy is something that people found really helpful for clients with FASD. So an emphasis on harm reduction that prioritizes the dignity and safety of individuals with FASD. So brain-based differences may coincide with a longer time period of recovery and more risk of overdose or serious illness or disease. And so maintaining supports for health and well-being, regardless of abstinence, is crucial for this population. We offer options and ideas for using a harm reduction approach in our guide. Using creative and recreational approaches are strong alternatives to treatment programming. Often programming is based on verbal, abstract, or reflective thinking. This can be hard for individuals with FASD. So approaches like music, art, or sport can improve an individual's engagement and create success in recovery, and also can present an opportunity for individuals to find new hobbies or interests. And last of our 5 recommendations in this layer is program evaluation. So seeking regular feedback is an essential practice to ensure that individuals are finding the interventions helpful and effective in meeting their goals. Feedback in forms that are suitable to brain-based barriers like artistic or spoken rather than written can inform program adjustments. We really want to learn. There isn't a lot of research in substance use treatment with individuals with FASD. So if you are providing those services or trying to be more FASD informed, we really want some level of evaluation to say what's working, what's not working, so that we can improve these areas for across all programs. All right, and lastly, we're on our final layer here. So this is enacting person-first program philosophies. So there's significant stigma that surrounds FASD. And the recommendations falling under the broad category of person-first program philosophies aim to emphasize the importance of appreciating the person and all their unique abilities first, not their diagnosis. So specific person-first philosophies outlined in this section are cultural safety, sex and gender-informed treatment, trauma-informed care, strength-based approaches, and promoting interdependence. You might recognize these philosophies in your work already. They're not unique to individuals with FASD by any means, but we revisit them here with a perspective of working with individuals with FASD. So just for example, you actually feel you're heard and acknowledged as a person. gives you more of a drive to push forward or a reason to do it. So first in our philosophies is cultural safety. Cultural safe care should be an ongoing process that persists throughout specific treatment practices and activities. Cultural safety requires self-reflection from providers in regards to power dynamics that exist within treatment, how their own assumptions, beliefs, and values impact the services they provide, and efforts to address inequalities that exist in accessing and experiencing treatment. So cultural safety is an ongoing process that really requires reflection. Sex and gender informed approaches. So in this, we want to emphasize the importance of considering gendered factors in treatment. So for example, women with FASD might experience higher rates of interpersonal violence and sexual abuse that may contribute to substance use, while men with FASD may experience a higher likelihood of being involved with the justice system. Specific approaches are outlined in the guide to account for these gendered factors in treatment. Next, we have trauma-informed care. So the goal of trauma-informed services is to avoid re-traumatizing individuals and support safety, choice, and control to promote health and healing. Individuals with FASD may have experienced significant traumas, and substance may be used as a coping mechanism for trauma. So trauma-informed care emphasizes the importance of safety and relationships to respond to the complex needs in treatment. We want to also promote strength-based approaches. Individuals with FASD have many unique strengths that they can bring to treatment, and a strength-based approach emphasizes the process of identifying and leveraging these individual strengths to support success. And lastly, on our philosophies, we have promoting interdependence. And this pertains to the importance of different relationships in the recovery journey for individuals with FASD. Specific relationships include those with family and caregivers, staff and counselors at treatment, peers, and the wider community. So within this section, we emphasize the importance of taking care of oneself as well as a supporter of an individual with FASD to avoid burnout. So I'm just going to wrap it up here with some key takeaways. There's no one-size-fits-all model for substance use treatment with individuals with FASD. Every individual is unique in their needs and abilities, and approaches and strategies that are effective for one may not be for the other. The practices recommended here are designed to be considered in the context of your program and resources. Our hope is the recommendations outlined will provide you with ideas to add to your already existing skill set and knowledge. It's not a matter of if individuals with FASD can be successful in treatment, but how they can be supported to be successful. All right, and then I'm gonna, that's it for me. I'm gonna let Elizabeth take it away and talk about the next phase of our study.
Hello, everyone. Yes, I'm Elizabeth. I'm taking over into this new next phase of the project, which is very much focusing on youth. So over the next couple of years, our research team is expanding on the work that's already been done with a specific focus on youth, developmental and support considerations, mostly focusing on youth under 18 with FASD who may have accessed or are seeking treatment for substance use. So just as before, we're looking to build on practices that already exist and create further conversations and considerations for working with youth. Similar to the first phase, we're going through the same steps, but with that youth focus. So we'll have the expanded scoping review, learning about research that's been done, treatment programs, treatment-specific factors that would likely be helpful for those working with and supporting youth. As in the first stage of the process, there really is little research out there specifically looking at substance use treatment for youth with FASD. So we're expanding to explore neurodevelopmental considerations that may be helpful also within the treatment context. So I think we can go to the next slide there. So we're just in the midst of it all and getting into all of the research piece right now and going through looking at community treatment centers and programs that offer specific programming and supports to youth. But some of the things on our minds as we're going forward with this, the first one there is consent and information sharing. So this can be a trickier space to navigate when professionals are supporting youth, navigating conversations around this with youth and their family, and working with the youth and the family in a way that respects confidentiality and also keeps the youth safe and feeling supported. So for instance, considerations around custody, care, guardianship, involvement with the children's services, considerations around adolescence, right? Mature minor. So things around navigating that with youth and supports. Expanding potentially in the identification and screening with unique considerations around these for youth and their caregiver and support systems. The needs and context. So we're taking a deeper dive in a youth-focused way into considerations around neurodevelopmental needs, and experiential considerations. So looking at cognitive considerations, behavioral, social, emotional, and experiential factors such as trauma that might relate to treatment with youth. So already getting in there, there's some work around beliefs of youth and how that can align with or be different than beliefs of parents and caregivers. Some of the potentially greater level of embeddedness in the treatment process or dependence on support systems for youth. And in the harm reduction section, expanding on this section, so there is some work on youth and caregiver perspectives around harm reduction, as well as we may be touching on legal, medical, and developmental considerations of the use of the harm reduction approach with youth. And then the next slide, please. So we will also, as we move forward, be looking to send out surveys and have interviews with youth caregivers and supports and other professionals in treatment or planning capacities. We will also be having an advisory committee to consult with and who will help guide us on this journey. So we're looking to speak with youth with lived experience, caregivers and supports, researchers and treatment providers, or other professionals, for instance, related to policy development and such. And so with consultation and support with the advisory committee and the people we speak with along this journey, there will be some decisions made of whether we will expand the existing guide to incorporate the youth-specific elements, or if there will be separate guide and or training models specific to youth. Yes. So yes, as I mentioned, we'll be looking to connect with folks to speak with youth with lived experience as youth with FASD who have accessed or tried to access substance use treatment, caregivers and supporters of these youth, and professionals involved in substance abuse, treatment planning, policy, or research. So if this sounds of interest to you, I welcome you to please reach out. My email is at the bottom of this screen there. Is emcarlso@ualberta.ca. So if you'd like more information, if you're thinking, hey, this might be a great thing I would like to talk about and be involved in, I welcome you to reach out.
All right, so I think I'll wrap it up. So we're excited to bring you an introduction to our guide and the recommendations within it. The full guide is available on the CanFASD website in both English and French. And we purposely designed our guide to be a workbook and have embedded team and small group activities throughout to promote reflection and understanding of the information we've outlined in the guide. So here you can see a practice activity. And so each section, each of those different layers that we talked about has different activities in them and different things embedded that we would love people to use as some reflective practice and to work together to incorporate these kind of ideas into their treatment program. There's also a toolkit and additional resources at the end. So as we went through all of our resources and gained an understanding of what's out there for treatment providers, we also kind of compiled a really great resource list. And so at the end of the guide, there's a toolkit with like other guides that have been developed, other research that's been done, and links to all of those things, websites, etc., so that people can, if you're reading through the guide and you see something that's of interest to you and you want to learn more about it, right, there might be a link or something where you can then look at those other resources. So we encourage you to download this guide, go to the CanFASD website. You can find it there in English and French, like I mentioned, and look through it, see if, it's helpful for your practices. Maybe even this one section is more helpful than others. But we hope that people can use this guide. We are also adapting this guide into an online training. And so there will be an online training through CanFASD that will be accessible to treatment providers as well. So it'll have information from the guide, but also have additional information, a little bit more expanded, different mediums where you can learn and do like an actual training in FASD informed substance use treatment. And this will also, you'll receive a certificate at the end for completing it. Because we really want people to, as we talked about, one of our practice areas of improvement, right, is increased training and education. So that is coming soon. And you can keep your eye out on the CanFASD website for information about that. If you have any questions about this research, similarly, my email is here. And so you're more than welcome to email me if you have questions, thoughts, if you want to learn more about the project or anything like that. All right, and there's a QR code here with a link to which you can scan on your phones and link to the guide right now. So we really hope that you can do that and look through it. All right, and once again, all of this would not be possible without the treatment providers who took the time to complete our survey, the individuals with lived experiences who took the time to talk about us and give us their insights and information, and the advisory committee whose expertise really guided this project. Awesome, and I'll leave it at that slide. Thank you.
Thank you so much to both our presenters today. I just want to remind folks that there is a Q&A function at the bottom of the screen if you'd like to ask some questions. Well, if there's no other questions, I would just like to take a moment to, thank our presenters today for fantastic presentations. And I would like to thank each of you for joining us today, and I hope you will join us in future webinars. To get more information on CanFASD and to stay in the know with respect to all upcoming webinars and other resources, please check out our website at www.canfasd.ca or follow us on our social media channels to find other resources.
Awesome. Thank you so much, everyone. Thanks for coming and thanks for listening.
Yes, thank you all.